That's great. Perfect.
Is that better?
Yep, that looks good. All right, everyone. So welcome to those of you who are watching online on behalf of the South Asian Studies Council. I'm Sarah Khan, and I'm an assistant professor of political science. And this panel is about harnessing research for COVID response in Pakistan. And we're delighted to have with us Professor Asim Khwaja, Dr. Ghazala Mansuri, and Dr. Nausheen Anwar. And the goal today was to bring together a set of scholars who have been deeply engaged for a long time in policy relevant research in Pakistan, and to hear from them how their and their respective organizations' work can speak to and inform the specific socioeconomic challenges that COVID-19 poses for Pakistan, and to talk through how they're already building on this work to both highlight these specific challenges and to inform priorities and content of response efforts. And we hope that the conversation will also speak to some of the common challenges that other South Asian countries and developing contexts more broadly are facing. And we're hoping to have more of such panels, so you can like the South Asia Studies Council Facebook page or look out on our newsletter or website for notifications. So the format that we'll go with is that I'll introduce our speakers one by one, ask them to speak for about 5 to 6 minutes, ask the panel a couple of questions. And meanwhile, if you're watching, you can comment on the Facebook live stream with a question. And then I'll pose it to our panelists. So we'll start first with Asim Khwaja, who is Director for the Center of International Development and also Professor of International Finance and Development at Harvard University. Additionally, he's also co-founder of the Center for Economic Research in Pakistan, CERP. And I've asked him to tell us a little bit about the work that CERP is specifically doing in this moment to inform COVID response.
Great. Sorry, I'll just take a couple of minutes, and then Ghazala is involved in that work as well, so I think we'll hear. Is it okay if I just walk around? I've been doing too many sitting Zoom calls, and so hopefully this is okay. Let me sort of characterize a bit of our work by saying, in some sense, broadly, kind of the approaches that I think have been happening in response to COVID. All of the, mashallah, have been great, and not just in CERP, but many other places as well. And I would sort of classify them in kind of two broad buckets. There is responses, which are all about what is the optimal strategy in containing the spread. So, I'm sure we're all sick of hearing flattening the curve, but that's kind of the idea of physical distancing and things like that. So there's what is the best way of doing so? And, a lot of countries have moved towards some form of physical distancing, from sort of milder versions to sort of more extreme lockdown kind of situation. So there's a set of research going on in that area about how best to do so. And interestingly enough, that research mostly is public health people and epidemiologists who are kind of really taking the lead in that. And then there's a second strand of work, which almost, to put it sort of bluntly, is the unintended consequences of physical distancing. So when we impose, especially for poor countries like Pakistan, when you start imposing physical distances or lockdowns, what are the consequences of other health outcomes? For instance, think of things like maternal mortality or infant mortality, which could be adversely affected now that access to hospitals. I was talking to students of mine in India, and they were saying, for instance, already the number of women showing up in hospitals has drastically dropped. And obviously, it's not that fewer women are pregnant. It's just that they're choosing to have pregnancies at home, which could be a risk factor. And so think of the unintended health consequences, but also even more saliently, the unintended economic consequences. So this is sort of welfare, think of people's jobs, livelihoods, food security, but also sort of longer term sort of industrial impacts and kind of macroeconomic impacts. And a lot of the work that I've been doing in Pakistan through CERP is very much on both of these buckets. I'll let Ghazala speak more on the second bucket, because she's really been leading some pretty amazing work. It's challenging, but so I'll let her talk on that. On the first bucket, which is, and here it's interesting for me, I think one of the, I would argue, economists need to join public health people and epidemiologists over here. It's kind of unfair to just rely on that discipline. And in the following sense, a lot of these epi models are great in predicting viral spread, but they don't incorporate human behavior in them. They have no model of human behavior. And so when you think of things like what will social distancing do to drop the infection rates, you need to feed that through what humans will actually do, because it's not that you can, so a lot of these models, you just change the R0 parameter and you make it drop, but that's an outcome of people. And if people aren't complying with the policy or people aren't understanding the policy, then that won't happen. So for instance, just because you've shut workplaces or schools, but if we go home and we all start meeting our extended families, that's not going to help at all. So you bore the entire cost of social distancing in a productive sense, but you didn't reap any of the benefits in a health sense. And so what we've been sort of working with now is both at the national level with the national kind of COVID response team, but we've started working with some provincial governments, KPK and Punjab to begin with, but we're hoping we'd be able to do it with the other provinces as well, is thinking through what would be a smart strategy. What's a smart response to COVID? And the way you should think about it is, it's very simple. Think about it like different levels of alert, for instance. So imagine you're in a region, you're in a district, and you need to have your policy be based on the local conditions of different areas. So for example, think in terrorism alert, we have like yellow alert, amber alert, red alert. So the first thing to do is classify your regions based on testing on which situation they're in. So is infection really spread? Is it in a red situation? Green is infection hasn't started as yet. And you can think of subunits like villages, clusters, which you can isolate if need be. And so what you need to have is first a general strategy of what is the classification, the color classification, which would be publicly announced. And then depending on which color you're in, your testing strategy and your social distancing strategy or physical distancing strategy and your welfare response will differ. So just to give you an example, imagine you're in green and you think you have no infection. You can't go testing randomly in the population. We don't have enough tests. But you can do things like sentinel surveillance, which is, for instance, in polio, we do this a lot, which is take samples of water, sewage water, and from that you can detect basically COVID presence. And we already have a great setup in polio to do this. We could just deploy that. So you could catch, the trick is to catch the infection as early as you can and isolate and quarantine depending on whether the person is symptomatic or asymptomatic. So the sooner we catch, the sooner we can prevent spread. And you can imagine sort of in between stages, call it orange or yellow, where infection has started. And there it's all about contact tracing. Your testing strategy B is going to be figure out who are the people who are in direct exposure for extended periods with the infected person and either quarantine them if they're asymptomatic or isolate them and move them to ICUs if they're symptomatic and severe symptoms. And all the way to red, where if some place gets into red, and Pakistan already has seen cases like this. For instance, Rawalpindi City is like this. There's UC Manga and KPK where the infection was so high that the best response was to just quarantine the area from the rest of the areas from spreading. But remember, you now need to be very careful when you do something like that to an area. You have to realize that area will need a lot of help, right? Because the other narrative around this also is that somehow this is a bad thing. It's not a bad thing, it's an illness, and we need to help people who are ill. So if you quarantine an area, you need to make sure you have food supplies, health supplies, because that area will need a lot of support. It's like New York City in the US, which needs a lot of support. And so that's why you should tie kind of responses to these areas. The last thing I would say, and then I'll stop, is in all of this, it's critical to get the right community messaging going. You know, this is one of those things that we cannot solve it if we don't have people's trust. We need to have individuals comply with policies, but voluntarily comply. We can't force people to do things. And so you need to share. So a good example of this is if you look at Como in New York City, he's done a really good job in communicating to the public about what's happening, what is the current situation, why are we doing what we're doing. Hence our reasoning that when you declare these color alerts, people should know I'm in a red situation or green or yellow, because then they can change their behavior accordingly. And they should also know that the state is supporting them, that their needs are being met. And that's why you need to have call-in facilities where if you have problems, you can call in and say, look, we're not getting bread or atta, or, you know, we have this health issue, so we can target our support services better to them. Because unless our citizens feel protected, they will come out. They have no choice. And then if they come out, you know, they can potentially spread disease. So that's basically in a nutshell what we're trying to do. And actually, I would say one last thing. A lot of this is unknowns. So you can decide your best policy, but we honestly don't know the effect of that policy. So one of the things we're trying to build is a learning process in this. So imagine in an area, you collect some data and you implement a policy. You want to go back 2 weeks later and see what happened. and then you can refine your policy. And I think that's going to be really critical, both for in real time coming up with the best solution in Pakistan, but also, inshallah, over the time, building a body of knowledge which can help other countries now, but also in future as well. So let me just stop.
Great, thank you so much, Asim. And I'll come back to some of those points that you've raised. But let's move on and hear from Dr. Ghazala Mansuri, who is lead economist at the Poverty and Equity Group in the World Bank. She's extensively researched topics of community-driven development, health, sanitation, and household behavior in Pakistan. And I'm going to ask her to talk about how some of the insights from this work are informing the work that she's currently involved in directly with COVID response. Over to you, Ghazala.
Thank you, Sarah. The work we're involved in with regard to COVID response is actually very wide-ranging. But let me sort of maybe talk about two things. One has to do with the challenge of targeting relief efforts in Pakistan under these conditions, under a sort of an emergency of this type. And then I can come to the water and sanitation research and what we have learned from there and how that speaks to this current situation. So in terms of the challenge of targeting relief, I think three things have emerged very clearly over this time period. It's been enormously difficult to actually identify people in need. Why? We do have a flagship program, a social protection program, which has a national social economic registry. The answer is the BIS program, but it's a static system, and it's now 10 years old. So because it's static, and over 10 years anyway, things like this PMT type of approach tends to decay, its ability to actually identify people who need help right now is extremely limited, right? So there are errors of both types. People who are really in need are excluded. People who may not be in need may be part of the registry and may end up getting a benefit that they don't actually need, right? So there are challenges on both sides. So I think what's become very clear is that for a country like Pakistan, going forward, I mean, we're dealing with those challenges now. The government is trying to do whatever it can under the, as best as it can, by trying to bring in some of the, particularly trying to bring in some of the kind of what we would call big data types of admin data of various types to inform the registry in some ways, to restrict. And what those sorts of things can do is they can help us with sort of exclusion, right? So you want to exclude some people, right? But they can't help you with exclusion errors, which is people are just simply needy, people are just not in the system. There's no way of bringing them in. So we have been trying to advise on that front. There are huge challenges to actually implementing any of this. Some of them have to do with access to the relevant data. Some of them have to do with the fact that we haven't actually had time to vet or make that data credible. So one example I'll give you, which is kind of a little bit out of the box, but we think is very useful data, is that cell phone ownership is now near 100%. I mean, the new highest shows that 98% of urban households have at least one phone in their house, and 95% of rural households, right? So under those conditions, a potential way to proceed is, for example, to use the revenue bands of the subscriber database, right? So every telco knows what revenue band a subscriber falls into, right? And by using those revenue bands, you can actually see that they are likely to be in the bottom quintile, that they're urban, that they're located in such and such a space, right? Actually, that data is fairly, can be made geospatially quite narrow as well to identify hotspots. But there is no straightforward way of integrating that data right now with the other admin data, right? So think of that as market data. So there are types of big data that is market data. There's types of big data that's admin data. So we do have an NIC, which is an amazing system. So every person's telephone number is tagged to their national identity card. You can back out family structure. So in principle, we actually have very good systems that exist. The integration of these systems hasn't been done, right? So for example, for us, tax records are not going to be useful, but a car ownership, motorcycle ownership, these could all be integrated very easily. So our big sort of, I think, lesson from all this is how important it is that we move towards a credible integration of admin data and even bring in relevant forms of big market data to create a system that is just more dynamic, right? And able to respond. Within that, perhaps there is still scope for these kinds of service suite type approaches like a PMT, but clearly they take a very long time to implement and they get outdated extremely fast. So if you have a new flood or some other outbreak, they're not going to be as useful, right? So I think for us, we are engaged in a two-part effort. One is to try to see how best to get the current beneficiary identification done in a reasonable way with what we have, but then hopefully to bring to the government's attention how important it is that we move to a dynamic and credible structure, because this is not the last time this is going to happen, right? This is an ongoing issue. Maybe we have a flood in 8 months or next year or something, and those things also pose very their own but very different but equally significant challenges. So that's on that front. In terms of research, or at least what we are focusing on right now, which is putting into place both monitoring surveys, particularly in large cities. So we're focusing right now on large metropolitan areas, Karachi, Lahore, Peshawar, Quetta, and a couple other cities, Multan, possibly Hyderabad, and sort of getting monitoring surveys rolled out that are IVR based. So they're very short and they get at issues of food security, inflation in key commodities. And a third one that we're about to roll out that's actually very focused on water and sanitation broadly, so wash related behaviors and access. So whether people have access to soap, sanitizers, masks, whether they have access to a place where they can wash their hands, right? Things like that. That should roll out in about a week. The price survey and the economic impact survey and the food security survey have rolled out today. So that should give us data every 24 hours on these things. We're trying to make it as granular as we can. So for Karachi, for example, we have 34 towns for which we'll get the data. And then we can try and drill down below that level once the data starts to come in, and we can see whether there are hotspots that are below that level. So I'll stop here on the data front. We can come back. This is to be followed by a CATI survey on revealed phone numbers to get more detailed information on employment, informal, sort of what's happening in the informal economy, things like that. Yeah, so I think on water and sanitation, I just want to maybe take a minute and say, I think what we've learned already is that we have two types of challenges. One is that access to safe water and sanitation is terrible, even in large areas like large metro centers like Karachi, for example, right? But it's absolutely dismal in rural areas. There just isn't any safe water or sanitation. Health behaviors are also extremely risky. People don't know, or people simply live in a context in which the marginal sort of difference that they see to their making that sort of investment in health behaviors may be low, perhaps, right? Maybe they don't understand how much of an impact they can have. The combination of these two things is already imposing a very large health burden, right? It's not an emergency of this type, but if you think about the impact on stunting, on other sort of water toxic sort of borne diseases, which are many, right? And they're imposing very serious health costs. I think and these are both inter and intra-generational costs. So they're very long-term. And I think that requires, that requires very serious work. So we are doing some work on that. I can talk about that, about projects that are in the pipeline to actually, in rural Punjab in particular, in that direction. But let me stop here. I think maybe we can come back to some of these issues if needed.
Great, thank you so much, Ghazala. We're going to move on now to hearing from Dr. Nausheen Anwar, who is a professor of city and urban planning at the Institute for Business Administration in Karachi. And she's also director of the Karachi Urban Lab. And I've asked her to tell us a little bit about the Karachi Urban Lab and the work that it's been doing, not just during this pandemic, but also leading up to it, that really highlights the challenges specific to urban environments during this crisis. Over to you, Nausheen.
Thank you very much, Sarah. Thank you for inviting me to be a part of this very important discussion. So Karachi Urban Lab is situated within the Department of Social Sciences at IBA. And we comprise a bunch of urban planners, architects, and social psychologists and social scientists who are working on different kinds of projects relating to issues of rural urban development, land tenure, infrastructures, climate change, etc. We've got multiple projects funded through different channels that are currently ongoing. Over the last 20 months, we've been involved in a very extensive project on evictions and land displacements, which is focused primarily on Karachi. And this particular project has been looking at approximately 12 to 13 informal settlements across Karachi's landscape. Informal settlements that have been targeted by the Supreme Court-backed anti-encroachment drives. And these particular settlements comprise residents or populations that are predominantly working class, lower income, lower to middle income. And what we've been following is in these sort of different districts in Karachi, from District Central to District South to District West, where the vast majority of these anti-eviction drives have taken place, there are approximately 1,000 or so households that have been rendered homeless. And as a result of these very, very brutal evictions. And I can, if you guys are interested, go into a deeper explanation as to how this has happened, specifically in District Central, where because of certain electoral changes and the specific on-ground shifting realities of Karachi's political economy, District Central has been hit the hardest in terms of specific neighborhoods that have seen very, very brutal demolitions. So quite accidentally, we've fallen into this present moment of looking at this pandemic, which has actually exacerbated or brought to the forefront the socio-spatial inequalities in which the workings of both federal, provincial, and local government are deeply ensconced. And it's sort of these very variegated, at one moment benevolent, at the next moment very authoritarian, very extractive, and very violent urban planning regimes that feed into this crisis of vulnerability in different ways. So typically speaking, these are informal settlements. I mean, they could be myriad toponyms that could be used for these kinds of settlements, from Kachi Abadis to unplanned settlements, but they're definitely not slums. But they have slum-like conditions, and they are replete with all kinds of infrastructural deficits, from issues of acute shortages of water, sanitation, sewage systems that are in a very decrepit state. And this is again largely because of Karachi's very peculiar political economy, where local municipal government systems are being held in abeyance because of a political crisis between different political parties in terms of turf wars. And then alongside those kinds of infrastructural deficits, healthcare crises. So we've been conducting surveys, doing ethnographies, open-ended interviews. And what we're finding now, of course, is that in the midst of these lockdowns, it's precisely these kinds of neighborhoods, especially those that have been at the sort of forefront of these very brutal evictions, families who've been rendered homeless, that are kind of those populations that are sort of very much at the bottom of the hierarchy in terms of being completely invisible. So you have a situation where even district commissioners, for instance, that of the DC of District Central, there are no efforts to even acknowledge the existence of these particular kinds of populations, because the anti-encroachment drives or orders were Supreme Court backed. So there is this sort of functioning, through the lens of illegality. There are specific kinds of population that have been rendered completely invisible in the course of these eviction drives, in the course of these disasters and sort of everyday crises. And so the question of welfare agencies, food supply, resources reaching out to these particular populations, this particular issue has become very much a disaster, something that the pandemic has worsened. So these are the kinds of situations that we're looking at right now, and And we're sort of trying to think about how do you kind of think about disasters and crises in this given moment? And one of the things that we're trying to conceptualize is that, we have to think about disasters in a very different kind of way. Often we think about disasters in very spectacular ways. We think of them as floods and climate emergencies of those kind. And we don't necessarily think about these everyday disasters that are an outcome of very violent urban planning regimes at the molecular level. So I'll just stop right there, and then we can have a further discussion about these particular dynamics. Thank you.
Great, thank you all so much. So we have a bunch of questions already coming in from people who are watching live. And before I turn to them, I had one question just as a political scientist, which some of you have started talking about, is about the specific challenge of what this looks like in a federal system and the issues of coordination between different levels of government. And Nausheen, you started to speak with this, talking about the municipal level at Karachi, but this is sort of a problem across provinces. And I know that all of you have thought about the question of decentralization in one way or the other as part of your work. And so I was hoping you could speak to what challenges for coordination a decentralized system, or what opportunities for coordination a decentralized system poses at this time.
I'll take that very quickly. If I speak specifically from the Karachi context, I think that this particular moment really delivers very sharply, the importance of having local municipal devolved governance systems in place. So when people talk about reaching out to their district commissioners at the molecular level, it's impossible. DCs simply don't have that level of connectivity with their constituencies on ground, which say a union councillor might. But decentralization, devolutions, there's a considerable amount of literature coming out of political science and urban studies, etc., on this. And I'm not necessarily just for decentralization. I think it really depends. You might want to have both. It depends on the nature of public services that are being delivered. And in this particular instance, I think what we are seeing on ground is that people are very much sort of the populations or the residents or the communities that we've been embedded in for the last 20 months are making it very apparent when they say, well, where is our local councillor? How do we connect with our local council? How do we connect with our UCs? So you have a situation in Karachi where the mayor is powerless. The UC as a really kind of exist in name only. There's a structure out there, but it's kind of a ghost structure. And the entire system of sort of governance has been further centralized at the level of the chief minister and the governor of Sindh. So although they feel that they are sort of quite capable and have the capacity to resolve these issues in this particular moment of emergency, time will tell. But in terms of what we are seeing on ground, it doesn't necessarily seem that way. So yeah.
Ghazala, do you want to jump in? I'm happy to.
Go ahead, Asim, I'll come after you.
So I guess I should say one thing. It's a great question. First of all, I don't think it's a coordination issue between different levels of government. There's huge coordination issues at a given level of government. And this is not surprising. This is not just true in Pakistan. In pretty much any situation, coordination is a challenge. In any situation which requires a rapid response in an unknown terrain, which is where we are, it's not business as usual. We're all a bit lost. We're all a bit late in acting, just the nature of the problem. So you're going to have these coordination problems massively. So that's not the unexpected part. The question is, what's the way out of this right now? I'll defer to colleagues of mine who've studied this more. So Matt Andrews is a colleague of mine at the Kennedy School, and he does a lot of sort of public management. And he's got a great series, by the way, I plug for him as well, on their research group called Building State Capabilities. They have a series of blogs about leaders and messaging and also coordination issues. And I think one of the things, at least talking to Matt, is clear is that while you don't want to circumvent the normal apparatus of the state, unfortunately, the reality is in situations like these, you do need to set up special task forces. That's that is the only way, really. And I think Pakistan has done that, which is great. But then the question is, these task forces need to figure out how best to, these task forces typically are federal, like ours as well. And so they need to figure out what are the units of government, both at the federal level, but also at the regional, sub-regional, even all the way down, as Nausheen was saying, to the union council level. And what is their respective roles and how we can support them. So the nice thing about having these task forces is if they play truly that coordination role, which is basically a resource provision, information sharing and information dissemination. There could be great successes coming from one part of Pakistan. Sharing that with another part will be really useful. I think sort of creating that roles. And the second thing I would say is, look, crises like these just cannot be handled by the state itself. It's just not possible. I already talked a bit about citizens being involved, but you have amazing work going on in civic society organizations, private sector organizations. So I would say when you create task forces like these, and also just volunteers. I mean, there's some pretty amazing work being done by people just volunteering. But you don't want the good to become the bad, in the sense that there's ways to do these things. Just rushing up in crowds and helping, like Nausheen mentioned, earthquakes are very different from disease spread situations. I completely agree. So things like protective equipment, PPEs, basic training, basic hygiene. It's one thing to be physically distancing yourself, but if you're going to be a relief worker and helping someone out, you have an even higher onus on you on making sure you're healthy, but making sure you're not communicating your disease potential to someone else. Like, so the worst scenario, you become a disease vector. And so information like this, a central force can do, or a central body can do, but then it really needs to increase its mandate beyond just the state apparatus and the different levels of the state to kind of the societal apparatus and sort of support them. So I'll kind of stop there.
Yeah, I completely, just jumping in, I totally agree with what Asim has said. I think this is a huge challenge and an unexpected challenge. And I would say, though, that it does kind of highlight the need to set up systems in ordinary times that are capable of coming into action in extraordinary times, right? And for me, I mean, I've seen, there is a big coordination challenge going on. I think even between the federal and provincial structures, we don't have streamlined systems. And I'm again going to come back to data, because honestly, at this point, if we had the right data systems and we had systems of communicating that effectively to the people struggling on the ground, right? You see every person you talk to at the provincial level, at the federal level, they are struggling to understand what they need to do. We don't take the whole idea of geospatial data seriously, right? Everything is an unnecessary secret, I think. I mean, at this point, geospatial boundaries are known to anyone who needs to know them. We need to make them known to the people who are making decisions on the ground, right? In a transparent way. They need granular information. For example, where are the low-income neighborhoods of Karachi physically? How would we create hotspots that were available to every decision maker on a map that they can track? We have those systems available. We just need to put them together. I think it would be enormously helpful if there was better communication on that front. And I think this really is a signal to me that we need to go there. The other type of coordination failure is, I think, what Asim was also referring to, which is this thing we have of thinking in silos, right? The food ministry will do this, the agriculture ministry is doing that, not my job, it's health doing this, right? Now, in a situation like this, those boundaries have to fade and fade fast, right? Because it may be important, for example, Asim, when you do a lockdown, you need to get food supplies. Maybe you want to use your food stores, give free food, right? At this point, I mean, would be my view. Get it out. That's why we keep food stores, right? That's why we have this sort of food security. So this may be the time to use those food stores, for example, and use them generously to keep people calm, to keep people doing the things you want them to do, right? So that requires cooperation across ministries and mandates, and a task force that actually can command these people to come together and say, look, we have to do piece 1, piece 2, piece 3, and piece 4 at the same time, right? This has been a real challenge, and it's not just Pakistan, I agree. I mean, everybody's challenged. And so we should, and it's not about saying, it's not about laying blame. It's about actually identifying how we might want to move post this to inform how we should, because this is not going to be the last time. It may be a disease today, another crisis tomorrow. It really would be nice if there was a conversation beyond this as to how we're going to proceed going forward on this issue. Let me stop here. Yeah.
Thank you, Ghazala. So I'm actually going to turn it over now to Mushfiq Mubarak, who is director of the Yale South Asia Studies Council, professor of economics, and also leads the Yale YRISE initiative for him to ask all of you a question. Mushfiq, do you want to go ahead?
While Mushfiq is doing it, I noticed, I've been watching the live tweeting, and I noticed Musharraf kind of was being tongue-in-cheek and saying, we're saying the state isn't adequately responding. I just want to correct that. I think the state isn't sufficient. I don't think in any crisis a state response is sufficient. I don't think it's fair to only rely on the state. It's true over here as well. It's true in Pakistan. It's true in most countries. You need state and non-state actors to be working together.
Mushfiq, I can't hear you.
Okay, is this better?
Yeah, we can hear you.
Sorry. Yeah, I had headset on for teaching earlier. Thanks very much, Ghazala, Asim, and Nausheen for doing this, for spending your time. I know all of you are very, very busy. And I just wanted to actually ask a very general question, but about the nitty-gritty of what is going on. So just going off of what the comment Asim just made about non-state actors, right? So what are the analytical pieces? What are the non-state actors like you? Exactly what are you doing that's helping? And it's a selfish question because we're trying to learn like what else or what we should be doing in Bangladesh to respond as well. So what are the ideas that we can steal?
If I could just very quickly jump in on that question. So here at the Karachi Urban Lab, I mean, we're academic actors, if we could, so sort of somewhere between state and non-state. I'm not quite sure what we are. So in Karachi, the civil society organizations have been incredibly active. Members of our own lab are involved with a wonderful group of activists called Karachi Bachao, who have been involved in the anti-eviction drives in sort of putting communities together and identifying, and this has been going on for the last 20 months or so. And they're one of the organizations that have been at the forefront of the relief efforts. And this is just one that I'm mentioning. There are myriad others who have been coordinating with welfare agencies like Silani, et cetera. We've been trying to do the same. So there's been a huge response from non-governmental organizations, urban resource centers, one of them, and NGOs, community activists, you name it. But I will tell you, they are overwhelmed. So, you can have civil society actors, NGOs that have been on ground in cities like Karachi for decades, doing all kinds of things, who are now rising to the occasion extremely well. But, this is a crisis moment of extraordinary proportions. And it's an apocalypse, if one could even call it that, and to be very dramatic. And there is a limit to what civil society, non-state actors can also do. So, and in the midst of all this, of course, we have typical, because this is Pakistan, it's a deeply militarized state. We have a security state apparatus on ground that is also kind of fingering things in very interesting ways. It's the Rangers are there. And we've been hearing all kinds of things. And when I say we, myself and my colleague at the Karachi Urban Lab, in terms of, which is not to suggest that, I'm trying to put a sinister picture in terms of what, of their own capacities. I think it's a shock for them also. But that security apparatus at the ground level is also creating its own dynamics that are very difficult to understand, because, the chief minister wants that the security apparatus should be harnessed in such a way that the civil society organizations and the welfare agencies should be coordinating with them. And it's not quite working out. So there are all kinds of unintended consequences as a result of that. So I think that we're all sort of living in a moment where the learning curve is very steep and very much anxiety ridden. It's and anxiety driven. Most of all for the urban majority, the ordinary citizens out there who've been impacted the most in this current moment.
We can go in the same order if Ghazala that works.
Yes,
so
please.
in terms of, so let me sort of divide actors, Mushfiq, to your question, into multiple levels. Let's start with the most inward-looking, us academics, sort of researchers. Look, I think one thing which is, and I sort of alluded to Mushfiq in the earlier response that I have, which is what has been really interesting for me and sort of eye-opening in many ways is how, you know, to me, you know, when COVID first hit, sort of I was just struggling with understanding myself what the hell was going on. I'm a reasonably quantity guy, and so I was just trying to understand, why do we have this physical distancing meshing coming up? Why is it so strong? What does this mean to flatten the curve? So I kind of got a bit obsessed in just understanding these models. And it made me realize kind of how fruitful a collaboration could be between a bunch of these fields: epidemiology, public health, frontline kind of health people, economists, statisticians, sociology. I mean, there's a whole, the solution to something like this requires understanding and knowledge from across disciplines. You know, we talk about interdisciplinary work and cross-disciplinary work, but I've never seen it so tangibly demonstrated in a way that it could really add immediate value. And so from a very narrow academic perspective, that's really been an eye-opener for me. And in the effort that I was mentioning in Pakistan, you know, I've been talking to Dr. Saad Umar. He's Mushfiq introduced me to him, actually. Mushfiq, thank you for that. I had someone from Bangladesh introduce me to a fellow Pakistani, so I thought I was really thrilled by that. But you know, he's been phenomenal. He's an infectious disease person at the Yale Med Center, an MD, PhD, and so just his knowledge, combined with maybe some statistical things and some economic analysis we could bring to the table. I have another colleague of mine, Jishnu Das, who's involved in this, who's actually from India. So this has all become like a fun South Asian group, who's a public health guy, and so does public health work. And then, you know, people on the field who are kind of Maruf, who leads C, who's a kind of an organizational leader, you know, Tahir, who's an educationist. So it's just been, you know, Adnan, who's a kind of public management, understands that sort of world. So that's just been really eye-opening, right? And I do think, you know, I'm sort of hooked in some ways, that I feel like, you know, I'm interested more and more, so that the next time this comes around, we're less unprepared. I feel like intellectually as a community, we were a bit unprepared. And so, you know, unfortunately, these things will keep coming. And so next time around, we should learn better and not have the kind of costs we're beginning to or having to pay now. So that's kind of one at a very narrow academic level. Then at other levels, when you think of different actors, as Nausheen mentioned, civil society, private sector, and the public at large. I think all three actors are going to be really, really critical. The public at large, I emphasized a lot, because unless the public at large is actively solving the problem, we can't solve it. You know, you have to realize that all these social distancing, physical distances effects will not come up unless the average citizen, the average Pakistani, understands the situation. And look, the situations are going to be extremely different. As Nausheen mentioned, someone living in Kachi Abadis in Karachi, like, what does physical distancing mean in that context? I don't understand. It's not like the US, you can go back home and in your nice little house, right? It's a very different domain. And so I think understanding their needs and getting them to be part of the solution, to say, look, this is feasible for us, this is not feasible for us, is going to be important as we incorporate kind of decision rules or policies, that into policies. And then from the nonprofit sector, I think Nausheen has mentioned, look, this is overwhelming. Those guys are doing phenomenal jobs. I've had a chance to talk to a few of them. I think helping them complement the state, and the state complementing them and supporting them with information, with resources, with manpower as needed. Look, the state has mandate to do these things. I think that's going to be really important, and not necessarily being suspicious about everyone. I mean, I'm not alluding to that, but Nausheen did mention some version of, you know, that. So, you know, look, our army is a huge actor, and the army coming in a complementary way, both to the state, but also to civil society, is going to be critical. We need their manpower. We need their resources. There's just no doubt in my mind. The last thing I would say is in terms of the private sector. I think, look, there are two roles to this. This is also, we shouldn't forget, a huge economic shock. And it's a productivity shock. It's not just a demand shock. It's not that people aren't going to have income shocks and demand less. We're going to be able to produce less. Our production facilities are down. And so thinking through how we're going to keep producing, first of all, are we producing the necessary equipment, like health equipment, protective equipment? So our firms coming up and redeploying their resources and volunteering to say, look, I can make masks, or I can make respirators. That's going to be critical. And without the private sector CEOs stepping in and saying we're going to take on that role, and we'll worry later on about, our own interests and subsidies and all that. Let's not get into that discussion as yet. Let's try and figure out how to do this. And then longer term, there are activities which we're delaying. How quickly can you bring the economy back on? So thinking about, are there production processes you can have in place which are de-densified? So you can still produce, but the human interaction is at a distance, it's safer. Because look, we need to be producing basic stuff. We can't just rely on inventories. And so that's going to be a really interesting set of questions as well.
Okay. Mushfiq, I think one way I could try to answer your question is, what are we doing from the point of view of research, or at least data gathering at this stage, possibly leading to a research base of various types. So on that front, what we are doing is, let me go back to sort of what I've begun to talk about, is that what we thought might be very useful right now. So of course, I'm not going to speak to the larger World Bank response, because that's happening in every space, in every sector, right, that is affected. So I'm going to focus on the data gathering part that we've been directly involved in, which is to basically roll out, at least in the big urban centers, these large-scale IVR surveys, which give us, the way it works in Pakistan at least, is that if somebody responds to the survey, so if you say, yes, I'm willing to answer these next 5 questions, which take a minute, then your phone number becomes revealable, right? And so then we get the phone number plus the data, and then that becomes the base for trying to run a slightly bigger 6 or 7 minute CATI survey, right? With these guys, with a subsample of these guys. What are the advantages? The advantages are that for Karachi, for example, we've broken up the city into 34 towns. So you get far more granular data, and we are targeting people in the bottom 2 revenue bands of the telco, right? So the amount that these folks spend is right about what the bottom 40 spend, looking at the latest highest data, which is from 1819, right? So you're actually getting, we're getting maybe 2/3 of our sample from the bottom 2 bands, and then maybe 1/3 from the higher bands, just to get a sense of other issues later, right? So you get so what that lets us do is 2 things. One, immediately inform the government every 24 hours that here's what we are seeing, right? In terms of people talking about inflation in key commodities. Here's what they're saying about food insecurity. They're very simple questions, whether you have food for a week, whether you had food yesterday, whether cooked food is available in your neighborhood, things that would immediately be possibly actionable if the government had it. And we're trying to put that on a dashboard for Karachi so that they can see it, and then they have the information. And we are coordinating this with the Sindh government. So hopefully trying to do the same thing for other cities once we have the first few days of data from Karachi, and we can kind of demonstrate what this can do. Yeah. So in the longer run, I think what will be really key is to understand both in urban areas, particularly the income loss that has occurred for workers at the bottom end, the income loss that has occurred for the bulk of informal small businesses on which the economy really runs to a very, very substantial degree. And what I think is very interesting is to also then map out the path of recovery, right? So there will be a big shock that will be immediate and medium term. And then how quickly do people start to get back to jobs? Which sectors recover? What types of informal businesses recover? How do they recover, right? Is it going to be loans, micro loans that are, and so at the same time, this effort becomes complementary with the kinds of interventions that are being considered. For example, micro loans for informal businesses, or perhaps speeded up efforts to encourage them to formalize through various incentive structures, subsidies, loan forgiveness, all those sorts of things that are being attempted. And for larger firms, perhaps wage subsidies to their workers to keep them employed. Now, with these sorts of surveys, you can then track whether these things are actually working and how quickly people are coming back, right? So that's sort of the goal and the hope to do that, at least for the large urban centers. So that's one of the things we're doing.
Great. So I'm conscious of time, and we have about 10 minutes till the hour. And at one point we had 60 people watching on Facebook Live, and people have questions. So what I've done is sort of group these questions by who I think they should go to, but feel free to jump in on any of them. And maybe we'll go in the reverse order and just come right back to Ghazala on some questions about targeting. So there's a question from Ahad Majid, which is, if the BIS PMT is outdated, is it possible that updating the poverty scorecard for the most recent PSLM could help, or is that data not helpful? And then there's another question on targeting, which is about targeting workers. And the big issue for targeting vulnerable employed workers is that they're not registered by their employment status. How can a rapid targeting mechanism be devised in the absence of this registration? This is from Alia Hashmi Khan. And then Sadia Siddiqui says, with reference to targeting, right now, inclusion errors are not important because every income segment is strained. So what would you say about that? So Ghazala, why don't you answer those really quickly, and then I'll get to some questions for Asim and Nausheen.
Great. So on the first one, the issue with the PMT being outdated is not one of data. The model has been updated. It's actually implemented through a service sweep, a census-like service sweep, to get the data from households, right? And only then can you know who to target, right? So the surveys give us theoretically who we should target, but then the PMT has to be actually implemented on the population. That's where we don't have an updated registry. When I say updated, right? So you need to go out and actually survey all these households, get their data, and that updates the registry, and you know who's now eligible in a way. So that's where new data is not going to help. We have the new data, but it has to be done in the field. On the second question, yeah, that's really important. So a very small a fraction of workers who are in the formal sector are in EOB and other systems from which you can track them, but the rest are not trackable. This is a vast bulk of daily wage workers and so forth, and informal workers, and it is very tough to target them. That's the whole problem, right? So if you had very dynamic registry systems, they could come into the net this way, but it's going to be hard to target them. Somehow, I think if we can set up systems, so our best sense was that by allowing people to self-register themselves, but focusing very sharply on urban areas, so that you don't have this wide number of people saying that they have needs, because needs are in a sense wide, even in good times, right? But right now you're trying to target a very narrow band of people who've been severely affected. So target on urban areas and perhaps use some forms of big data that we've been talking, that I alluded to. That's the best we can do in the short run to get relief to these people. On the third point, I completely agree. Right now, the bigger problem is exclusion, not inclusion. We can live with some bad inclusion. The problem is that when you have resources that are limited, and once those resources are exhausted, how do you reach the folks who are excluded, right? So I think that's a much bigger concern and should be the focus at this point. I hope I got to all three.
Great, thank you. So here's a set of a couple of questions for Asim. So Asim, you spoke in the beginning about the importance of incorporating human behavior into the models of what spread and recovery look like. There's a related question, and I'm sorry I missed the name on this, but it is, what are the resources you suggest people look at if trying to combat negative social behavior like interpersonal violence, which might not be caused by COVID-19, but may exacerbate it? And then there's another question which I'm posing to you, because I think you mentioned how you've been thinking about whether sort of lockdowns are justifiable given a set of data and the costs and benefits associated with them. So this is a question from Sahaj Sankaran. At what point does the human cost of lockdowns in India or Pakistan or Bangladesh exceed that of COVID itself?
Great. These are excellent questions. Let me answer the in reverse order. So on the second one, look, frankly, we may already be in that situation. We just don't know. both given the immediacy of what happened in the lockdown. I mean, the pictures from India, pictures from Pakistan, I'm sure Bangladesh was the same way, with like thousands crowding on bus stations. That's like the perfect way to spread disease, right? So I think the honest answer in this is, look, reality is we don't know. We don't know, and I want to echo what Ghazala has been saying for a while, is we need information, we need data. You can have as many models as you want, you can talk for as long as you want. Unless you measure these things, we have just no idea. And what we cannot afford to do, and let me emphasize that, we literally cannot afford to do is wait for that. You cannot, because it's too late then. There's lots of silent deaths may happen, like what I mentioned to you about infant and maternal mortality. We may realize 6 months down the line this happened. It's too late. Lives are lost. This is not about money versus lives. This is about lives versus lives. And so collecting data in real time to see when you implement a certain policy, a more extreme policy of lockdown, and what it does and what benefits it gives. This is an empirical question. It's not a theoretical question right now. And I think that's critical for us. And that's what we're advocating, right? And that's what Ghazala has been advocating as well. And you might think, look, data is costly. It's not. Look, we have a lot of call centers are sitting around now. So we're, for instance, in CERP, redeployed most of our people to just be calling. You can call people up. We're not socially, that's why social distance is a terrible word. We're not socially distant. We're physically distant. So we can get a lot of information from people, especially people who are in tough situations. And given Ghazala, what said earlier about the numbers of people who have cell phone penetration, that's a great resource to use. Use robocalls, use physical calls, get a lot of data, and then readjust your policies. If you're finding that the cost is too high and you can't put a mitigating measure, then you need to ease out, right? At some stage, we're going to come out of this. It's not that this is the new world we're in. So that's the first one. On the second, the first question, look, that's a really worrying question for me. You're already seeing cases where if someone's infected in your area, particularly there's a dimension, in the US, it's like the Asians who infected us. In Pakistan, could it be one ethnic group which brought, so there's very easy to start putting blame on people. And I want to repeat this, like we need to support, protect, and help people who are infected, right? These are victims. These are not perpetrators. And for that means the state has to, and now it's very important, this is a state's liability. The state needs to come in and make sure people are being protected and kept safe. So that's all I'll say to that.
Sorry, thank you, Asim. Here's a set of questions for Nausheen. So a number of people in the comments are, and this comes from Arshi Salim Hashmi, is that there's a huge focus on charity organizations. They're the first ones to get into action. Unfortunately, the discourse is all about charity more than a medical and public health response. Is this something, is this a trade-off that you've been seeing on the ground? Do you think that that's actually a trade-off in response? And then a question from Sabah Asim is about cash versus food as an instrument. And I'm wondering if you can use some of what you're seeing on the ground in Karachi and hearing from relief organizations about the utility of cash versus food in this moment.
Sarah, in response to both questions, it's very difficult to make that assessment at this stage, because a lot of we're still in a very foggy terrain in terms of trying to make very distinct conclusions about whether it's a trade-off between charitable interventions or interventions that are focused specifically on healthcare, or as pertaining to your second question on cash versus food. But in a very general sense, based on Pakistan's, or let's say in Sindh, for instance, if we take urban Sindh as an example, we already know that public healthcare infrastructural structures are already pretty weak. And one could say that is the case pretty much for all of Pakistan. So the extent to which public health representatives, whether they're operating through charitable agencies or through non-governmental organizations or in whatever form, whether or not they're already there on ground is an open-ended question. We're not actually seeing that happening right now in terms of these particular neighborhoods or communities where we ourselves are embedded, where we've been working in the last 20 months. And the healthcare concerns actually don't appear to be at the forefront right now in people's priorities either. It's right now really just a question of, well, where can we get food from, and what are at least the most important basic staples. So welfare organizations also in that sense, charitable organizations are responding on the basis of demand. Secondly, cash for food, it depends. I think it's a question that can vary from household to household. If you give them cash at the present time, in again pertaining, and I don't wish to generalize from the particular, again referring to those specific neighborhoods where we've been working, stores are shut, grocery stores are not open, telewalas are not present. So if you give people cash, they will say, well, where do we go and buy stuff from? Or there's already a shortage in the market. You know, in certain parts of the city, people can't find atta, they can't find flour, or even sugar for that matter. So people hence say that, you know, give us the food in return, because at least I can stock my kitchen immediately, right? So, but I would like to add, you know, one more point, right, which no one has picked up on. I think that in terms of thinking about this larger issue of resources, you know, the importance of resources, the different stock of resources that we think about in terms of making vulnerable populations stronger, more empowered, for a use of a better word. I hate that word, but I'll use it for the time being. It's the question of security of tenure. You know, I mean, cities across the global south have become war zones these days for, you know, for all intents and purposes. And this is not just Karachi. This is happening in large parts of the global south, where broader questions of urban renewal and very brutal planning regimes, issues of globalization, commoditization, FDI inflows. In the Karachi, Pakistan context, it's also CPEC. I don't want to make that into a big issue in this conversation, but infrastructure developments. All of these things kind of coming in, aligning in very complex ways that feed into the molecular terrain in terms of excluding ordinary citizens or the urban majority in very complex ways. And for me, I'm an urban planner, so the land question for me is really the question that drives everything. Security of tenure is something that feeds into everything else. If people have security of tenure, if they're not confronting tomorrow as this big question mark, will I have this home? Will I have this place? Will I have shelter over my head? Everything else gets aligned with that. Questions of healthcare, questions of improvement in terms of sanitation systems, water, all of that. I really, you know, sincerely believe that security of tenure should be made part of this broader terrain of these resources that we keep talking about, right? Because it is by default one of the most important things that you know, the urban majority thinks about. You know, the question of shelter is, I think, the most important issue out there today in urban Pakistan and perhaps across the urban global south. So I'd just like to end it there.
Fantastic. Thank you so much. And it's 11:03, so we still have lots of questions, but I hope that this will all be sort of a continuing conversation, and we're planning to organize more of these panels and keep having these conversations and learn from shared challenges across different South Asian contexts. And so thank you so much, Asim, Ghazala, and Nausheen for taking out the time, but also for the work that all of you are doing every day in the response. And a big thanks to Dr. Kasturi Gupta of the South Asian Studies Council for making it possible for us to go live and be virtual. I think we've managed to reach a broader audience than we are able to in our in-person programming. So thank you all once again.
Thanks, Sarah. Thanks, everyone.
Thank you.
Stay safe and healthy.
Thanks,
Bye.
Sarah. Thanks all. Bye.
Bye.